Hi, this is Cassandra at Blacksburg Veterinary Clinic. How may I help you? Hi, I'd like to make an appointment for my dog Mabel. She isn't acting normal. Can I make an appointment to see Dr. Edwards? Yes, ma'am. What are some of the symptoms Mabel seems to be having? She is becoming extremely tired after only small amounts of exercise and has a cough. Okay, we have an appointment available tomorrow with Dr. Edwards at 11 a.m. Will that work for you? Yes, it will. Thank you. I will see you tomorrow. So I understand Mabel is having some fatigue after exercising for a short amount of time. Is that right?
Yes.
And she's having a cough as well?
Yes.
What about her appetite? Is it decreased at all?
Yeah, she's not eating as much as normal.
Do you think she's lost any weight? I can look in her file, but
I'm not sure. Maybe.
all right, we'll weigh her and see if she's lost some weight. I think I want to run a few tests, including a 40x snap. So we'll just take her into the back and be right back.
Okay.
The 40x SNAP Pro is an antigen test which detects adult female heartworms. It takes 8 minutes to complete this test, and the results of Mabel's test unfortunately showed positive for heartworms. To confirm this test is correct, a blood smear is made and then examined under a microscope. Under the microscope, it is seen that many moving microflaria are present, confirming the heartworm positive. As you can see from this microscopic view, there are microflaria present in Mabel's blood. This confirms the heartworm positive. Now that the dog has confirmed heartworm positive, other tests need to be run to determine if it is in normal health for treatment options. A blood chemistry is usually run, as well as a urinalysis and x-rays to show if the dog is in normal health. If the dog has normal health, then treatment is a good option. Well, Dr. Edwards, I've never seen a heartworm around Mabel. How does she contract this? Heartworms are contracted by mosquitoes who contain the heartworm larvae. So the life cycle starts out with an infected dog is bit by a healthy mosquito, and the mosquito drinks the blood which contains the microfilariae. Then the microfilariae develop within the mosquito, and the larvae move to the mouth parts of the mosquito within 3 weeks. The mosquito then feeds on the healthy dog and deposits infective larvae onto the skin. The infective larvae then bury into the dog's live tissue for 3 to 4 months. The infective larvae locate veins that move to the heart and mature within 5 months. The infected dog now has microfilariae through its bloodstream as well as heartworms growing to maturity within the heart. This is why it can take up to 7 months for a dog to read heartworm positive. Now to discuss the physiology of the heartworm disease itself. Heartworms are first contracted in dogs and cats by being bit by a mosquito that is infected with heartworms. Once the dog is infected, young heartworms cause damage to the pulmonary artery walls. Endothelial cells become separated and inflamed. Heartworms cause the lining of the pulmonary arteries and the heart to become rough, and it disrupts the flow of blood. Therefore, dogs can become short of breath very easily, which is one of the symptoms. The arteries are unable to expand when more oxygen is needed when exercising. These worms reproduce, causing their numbers to increase. An increase of worms will eventually cause heart failure if not treated. Fortunately, Mabel's 40x SNAP Pro showed that she was positive for heartworms. We also did other tests to confirm this, including looking under the microscope for microflaria, which were also present. Her other tests confirmed that she was healthy enough to start the treatment of heartworms if you wish to do so. So that would consist of beginning her exercise restriction immediately. And we also want to start her on prednisone to reduce the chances of a bad reaction to the death of the heartworms. As well with that is doxycycline for 1 month to also reduce the chances of a bad reaction due to the death of the heartworms. Then we'll give the first injection of melarsoline, and we'll monitor her for the next 30 days. Then after those 30 days, we'll give the second injection of melarsoline. Then 1 day after that second injection, we'll give her the third and final injection of melarsoline. And we're going to continue with the prednisone and monitor her side effects for the next 30 days. We want to continue restricting her exercise throughout this whole time. So 6 to 8 weeks after that last injection and still restricting her exercise, We're going to test for the microflaria again, which are juvenile heartworms. And then we're going to test for the adult heartworms with the SNAP Pro DX. And hopefully by then she will be heartworm free. As the vet was mentioning to the owner of Mabel, prednisone is given to reduce the chances of a bad reaction to the death of heartworms. Prednisone is a steroid, so it reduces the inflammation. Doxycycline is an antibiotic and is given to weaken the heartworms, allowing them to be killed easier. If given with ivermectin, the uterus of the heartworm degenerates. This prevents further reproduction of heartworms. Melarsoline is effective against adult and immature heartworms of both sexes. Here is an overview of the heartworm treatment that I described to the owner. There are many complications to look out for during treatment of heartworms. One is the possibility for large numbers of worms to die at one time, and this can cause many complications. Symptoms of this include the development of a cough, or if the dog already has a cough, the cough could become worse. Difficulty breathing. The dog will become weak and lethargic. Their appetite will significantly decrease, and they will also show signs of vomiting, drooling, as well as diarrhea. This slide shows the overview of treatment length for heartworm. Treatment takes about 60 days total to be completed. To determine if the treatment was successful, treating needs to be done 1 month after treatment and 6 months after treatment. Prices of treatment depend on your area and your veterinary clinic, so these numbers are approximations. Testing for heartworm, which includes your SNAP 4DX Pros, blood chemistries, and your analysis, costs around $600. Doxycycline, about $40. Prednisone, about $55. 12 months of heartworm preventative, around $160. This could also vary due to brands used. 3 injections of melarsoline, around $300, and hospitalization/miscellaneous of $100. This brings you to a total of about $1,255. All of these prices are also dependent on the animal's weight. Smaller animals will have less dosages of medications, and therefore your price would be cheaper. You're here for your first melarsoline injection. How are you doing? It's time for your second melarsoline injection after 30 days. Yesterday you had your second injection. Today you get your third. It's a good girl, Mabel.